anyway, really excited to introduce Jim Hayek. Jim has been doing benefits advocacy for a long time. He'll tell you a little bit more about himself, but Jim has helped a number of OCSG members, including myself, put together a portfolio of benefits by his advice and his support through the application process. And he is the guy I go to whenever I have a problem or I have a question. So, welcome, Jim.
Okay, well, thank you for having me. My name is Jim Hike. I'm a public benefits consultant advocate. My background is in working with people with disabilities for many, many years. Started my career as a senior counselor with the Department of Rehabilitation, and my caseload was regional center consumers in San Diego, actually in the San Bernardino area, and then San Bernardino, and then in San Diego. I got recruited over to the community colleges in San Diego as a counselor and then rose up to be an associate dean of special education. And we ran programs for the what was called the limited learners. That was the regional center consumers. Then I got recruited up to Sacramento to launch the statewide foundation for the chancellor's office for the community colleges. And we were able to get contracts from both Apple and IBM to set up high tech centers for the disabled at all 103 community colleges at that time. I then got recruited over to become the executive director of one of the regional centers. It's Alta California Regional Center in Sacramento. It's one of 21 regional centers. And then for the past many, many years, I've been an advocate and I'm working with families navigating through all of the various public benefits, regional centers, special education, all the benefits from Social Security, IHSS. And so I do a public benefits assessment and work with families to assist them in accessing the benefits for their disabled children, children and adults. So today, put on your seatbelt because we're going to be going through a lot of benefits. There will be time at the end. And Judy, is there a way people can post questions, or how do you want to do that? And then we would address
Yeah,
those at
yeah.
the end.
So please use the chat if you have questions. Jim, if Robin or I can interrupt you if we think it's timely, we will do so.
That'd
And
be
then at
fine.
the end, Jim will have time to really respond to any other questions you might have.
That sounds great. Okay, so let's get started. So let's see if this is going to advance, which of course it's not. Why isn't it advancing?
A
Hmm.
hint is just put your cursor on the screen on the slide and then try hitting it forward again, the arrow. All right.
Here we go.
Oh, there you go.
Okay, so these are some of the benefits we're going to be talking about. Some of them are what's called needs-based, and we'll talk about what that means. But basically, it means that you're going to have some financial criteria that you have to meet, such as for SSI, Medi-Cal, IHSS. And then there's what's called entitlement programs. That means the person is entitled to those because either they, as an individual, or their parent has paid into the Social Security or Medicare system. And then we'll also talk about regional center. And I'm not sure we're going to be able to get to the Department of Rehab, but if you have questions about that, be more than happy because I do have the background of being a senior counselor with the Department of Rehab. So let's talk about SSI first, Supplemental Security Income. SSI is really not a Social Security program. It's not funded by Social Security contributions that people make. It is a welfare program. It's just that it's administered by Social Security Administration. And to be eligible for SSI, you must be disabled. This is also a program for people over the age of 65, don't have to be disabled, but we're going to focus mainly on people with disabilities. And the person must be disabled under Social Security rules. So what does that mean? Social Security determines that a person is disabled if they're not capable of grossing $1,690 a month. That's for 2026. It's not whether they've ever had a job earning that much. It's not whether there's a job available for them. It's whether upon reviewing all the records that they can obtain regarding the applicant, They will determine, Social Security will determine in its sole discretion whether the person can do SGA, substantial gainful activity. There also is the financial test. Resources are looked at and income is looked at. So we'll talk about those. Resources. A person cannot be eligible for SSI if they have more than $2,000 in the bank or anything that can be easily converted to cash. So investments, things that they own that can be, again, not personal items, but things that can be turned into cash. Many times I have clients that they didn't realize, or the parents didn't realize, that there were savings bonds that were in the Social Security number of their adult child. Social Security will learn of those and they will count towards the $2,000 resource limit. If it's a couple, two individuals, then they do allow resources up to 3,000. Now, not all resources are counted. And what we're talking about here is an adult, someone over the age of 18. Because if they're under 18, as you'll see in a moment, the parent's income and resources are what's called deemed to the child, and that usually makes the child ineligible for SSI because of the financial criteria. But once they're over 18, only the resources and income of the individual is counted. But not all resources are counted. An individual can have a home of any value. They can have $1 million home in their name if they live in it. It must be lived in by the individual. They can have an automobile of any value. If they have a second automobile, the value of that second automobile goes towards the $2,000 resource limit. Furniture, clothing, personal care items are not counted. Burial plots, certain types of life insurance, whole life is counted and they look at what the face value is of the policy, but not term life. And interestingly enough, special needs trusts, if properly written, will not be counted as the individual's resource. And by properly written, that means that it must, if it's money funded by the individual, it must have Medi-Cal payback language, and we can go into that in a little more detail if you have some questions. If it's what's called a third-party special needs trust, funded by anyone other than the applicant, the beneficiary, then it does not have to have Medi-Cal payback language. And basically what Medi-Cal payback language is that upon the individual dying, the trust is first having to pay back Medi-Cal for anything that Medi-Cal has paid for that individual since the trust was established. So Social Security wants to know if there's a trust, and they want to see the trust, and they want to see how it was funded, and that will determine whether there's Medi-Cal payback required or not. Also, of course, Social Security wants to look at that trust to see the distributions that are being made from that trust to see if it'll affect the individual's SSI. Now, there's different kinds of income that Social Security looks at for SSI purposes. You have to forget everything about IRS rules. They have their own definition of what income is. And the income can reduce the amount of the monthly SSI check. So not everybody gets the same amount. The type of income will have a different effect on the SSI. So they look at earned income. That's pretty straightforward. Wages that the individual's earning. They won't count the first $85 that the individual earns in any month. In other words, the first $85 the individual earns in a month will not reduce their SSI. But after that, there will be a reduction of 50 cents on the dollar. So for every dollar, their SSI goes down by 50 cents.
Jim, before we leave talking about money, someone asked about IRA accounts. If those
Yes,
are counted towards
if the IRA is in the person's name, it will be counted. If there's distributions that are required to be made, those have to be made and will be counted as income. If it's not in the person's name, of course, it won't count. But an IRA can affect the person's eligibility, yes. There is unearned income. That would be if someone gave the applicant money. The government, in its discretion, in its generosity, doesn't count the first $20 that Johnny might receive in SSI. After that, the SSI would go down dollar for dollar versus how it goes down for earned income of only 50 cents on the dollar after 85. And then there's in-kind income, which is a really tricky one that we'll talk about in the next slide. It is on this slide. So the maximum amount that a person can receive in California who's paying for their own food and shelter, actually it's just shelter now, the maximum amount is $1,233.94. As of last year, there were new rules that were put into effect for how the applicant's shelter is being paid for. It used to be if someone was paying for the person's food, it would reduce the SSI. But if you'll excuse the pun, food has been taken off the table, so you can pay for the person's food. Just don't give them the money for the food, because that would be unearned income. But you could pay, the parents or anyone could pay for the person's food, and it will not reduce the SSI. However, if the person's shelter is being paid for by anyone other than the beneficiary, their SSI goes down by $351.33. So it used to be that in order to avoid that reduction, the beneficiary had to pay fair market value for the shelter. So if they were renting a room or if they were living in the parent's home, Social Security would look at the mortgage payment, the property taxes, and they would divide by the number of adults in the home, and they'd say that's the amount that the person has to pay. Well, that changed as of last year, and it now is that the individual, if they're in their parents' home, or if their parents are paying for a residence, apartment, condo, whatever, outside of the home, the individual only has to pay $351.33 from some source. Now, they could pay it out of their SSI check, they could pay it out of a CalAble account, but if it's paid for by either of those sources, then they will get the maximum check of $1,233.94. Okay, so how does Social Security treat distributions? If there's a direct distribution from a special needs trust to the individual, which is something that we never want to have happen, it reduces the SSI after the first $20, dollar for dollar. But if the distributions are directly made, let's say for a big screen TV, the check is cut to Best Buy, no effect on SSI. If the trust pays, excuse me, for a trip around the world or golf lessons or new furniture, as long as that money is paid directly to the vendor, it doesn't go through the hands of the individual, then the SSI is not affected. And then again, direct distributions for shelter, no reduction if the beneficiary is paying $351.33, has a rental agreement with the parents, or that's being paid for through the ABLE accounts or CalAble. So I made reference to this before, that for a minor, the income and resources of a person having a duty of support and that's the parents usually, their income and resources are deemed to the person who is legally entitled to the support. So in other words, that's the parent's income and resources are deemed to a minor. A spouse's income and assets are deemed to the spouse. But once the disabled person turns 18, there is no deeming, and only the individual's income and resources are counted. So I made reference, so that's SSI, and I'm sure there'll be questions about that we can get to at the end. I mentioned CalAble. There are what's called ABLE accounts all over the country. These were established as a result of families saying, there's 529 plans, college savings plan under IRS rules that allow families to save for the education of their children, usually non-disabled children. And so the disability community said we need to have something similar for our disabled kids. So what we now have are ABLE accounts, and it's under IRS code 529A. California, of course, brands everything, and so the ABLE program in California is called CalAble. To be eligible to open a CalAble account or an ABLE account, you must be disabled prior to the age of 46. That just changed. It was 26 up until January. The funding that goes into a CalAble account can be funding from any source. The maximum amount, though, that can go into an ABLE account or CalAble is 20,000 per year to a maximum of 100. Actually, the CalAble account can have more than 100,000, but if it's over 100,000, Social Security is going to begin counting the funds that are over 100,000. Anything 100,000 or less is sheltered. It is not counted by Social Security, not counted as a resource for SSI purposes. And it can be used for shelter with, as I said before, it can pay that rent, and it can pay $2,000 a month of rent, and the individual would still be eligible for the full SSI check. The disbursements from the CalAble account can be for a broad range of purposes. It can be education, housing, health, personal support. So I strongly recommend CalAble accounts. They're sort of like mini special needs trusts because the money can come from any source. Grandma and grandpa want to give Johnny, money at Christmas and they don't want to have it affect his SSI. They could put the money into the CalAble account. It would not be counted as income to Johnny, and then a disbursement could be made from the CalAble account. And again, that would not be counted as income unless the money's given to Johnny, but it could be paid for something for Johnny. Okay, so if you are on SSI, you automatically get Medi-Cal, which is really great because dealing with local county Medi-Cal agencies is many times very, very difficult. If you're on SSI, you automatically get Medi-Cal. You don't have to
Jim,
deal with the local.
do you mind answering a question about the ABLE account here?
Sure.
What happens if the amount paid for shelter directly from ABLE account is more than 351.33?
Yeah, that's what I was saying. It could be any amount. It could be $5,000 if it's as long as it's paid directly to the landlord. The CalAble account can pay. But remember, there's only 20,000 a year that can go into the CalAble. So if you're looking at a disbursement that's going to be more than, you can do the math, whatever 20,000 divided by 12 is, you can't be paying a monthly rent from that that's going to exceed $20,000 annually.
And one workaround though, Jim, is if you save over time and you have up to $100,000, you could pay until you drain the account, right?
That's
Or
right. If you've started saving for 5 years, you've got 100,000 in there. So then that certainly is going to extend how long you can pay a high amount of rent before you run out of money. You're correct.
okay, and Jim already answered the question about where the money from the CalAble account comes from. It can come from the parent. It could come from actually employment too. It
Yeah,
can come from any
and
family members.
right.
Different.
And actually, there's a formula that they use that if it comes from the individual's employment and the individual puts that earned income into the CalAble account, it can actually exceed 100,000. I forget the exact amount, but it can exceed 100,000.
Okay, thanks, Jim.
Sure. Medi-Cal, as I think all of us know, is always secondary to any private health insurance that you have. Sometimes Medi-Cal can pick up co-pays, deductibles, that sort of thing. But again, if you're on SSI, you get Medi-Cal. Moving on. If you're on Medi-Cal, you qualify, and it doesn't matter how you get on Medi-Cal. You could get Medi-Cal by being SSI linked Medi-Cal or through the county. You therefore are eligible to apply for in-home support services. In-home support services, IHSS, it's a county program, and it serves children, both children and adults with disabilities who are unable to perform activities of daily living and cannot remain safely in their homes without help. Again, must have Medi-Cal. You must live in a home or an abode. That's the language they use in the law, an abode of your own choosing. That means that if you're in a skilled nursing, if you're in a board and care, if you're in an assisted living, if you're in any facility that's licensed, you cannot get IHSS. So this has to be either in, let's say, your parents' home, in the individual's parents' home, or in their own apartment. And the process is you apply, social worker will come out, do an assessment, and will determine how many types of services that you need and the number of hours that they will authorize to pay someone to provide that support. Maximum hours is 283, and we'll talk in a moment how you can achieve 283 per month. The assistance, though, is only if it's hands-on. So, for example, if Johnny needs prompting to wash his hair, and you say, Johnny, be sure you shampoo your hair, they will not authorize any time for that. If you have to open the shower door, put the shampoo on Johnny's head, and massage it in, they'll give you time for that. Same with dressing. If you just have to remind Johnny to wear a jacket, you won't get any time for that. If you have to help Johnny put his arms in the jacket, zip up the jacket, or tie his shoelaces, put the socks on him, they'll give you time for that. So it's very specific that it has to be hands-on. Now, the process is contact IHSS. The first thing that has to be done is you have to get what's called a healthcare certification form filled out by a doctor. And this form is pretty specific. It says that without IHSS, the individual would be in danger of having to go into a facility of some sort. So some doctors are a little hesitant to sign that form. So sometimes we have to say to the family, well, is there another doctor that maybe is willing to sign it? Because it is a pretty stark statement for some doctors to state. But if you don't get the healthcare certification form filled out, the county will not proceed to the next step, which is to do the IHSS assessment. Now, what they'll do is they'll look at, it used to be that they'd look at every task that you had to do. You know, if Johnny was incontinent, how many times did you change the diapers? If he soiled his bedclothes, if he soiled the sheets, how many times did you have to do laundry? How long did it take you to do the laundry? Is there a meal that's prepared separately from the rest of the family? How long does it take you to prepare that meal, to clean up that meal? They now, because there was such a discrepancy in how many hours were being authorized across the state, the state came up with what they call county guidelines. And they look at the individual's age, they look at the individual's disability, and it comes up with a guideline as to how many hours per task should be granted to that person. Once that assessment is done, some of you have probably seen it. It's a big long sheet that you'll get, notice of action. It actually lists every single type of support that a person could need and how many hours and minutes are being authorized for each of those activities. It also gives you the right, of course, to appeal. So what are the kinds of things that you can get authorized minutes and hours for? There's a category called domestic services: sweeping, vacuuming, taking out the garbage, wheelchair cleaning, battery recharging, changing bed linens. Then there's a category called related services: meal prep, cleanup, laundry, shopping, personal care. Some of them I've mentioned: feeding, bathing, grooming, dressing, bowel and bladder, transportation to medical appointments. So all of those are categories that can be hours and minutes can be given. Now, understand that what they look at is parental responsibility also. They look at the age of the individual who's applying for IHSS and what, for a 2-year-old, parents would be providing a whole lot of hands-on care. For an 8 or 10-year-old, they'd not be providing that hands-on care. And if Johnny needs that, then they could get hours for that. So they look at what would be the level of care need for a non-disabled child, and then what of the same age, and then what is required for the applicant, and that's how they figure out the authorized hours. Now, there's another category called paramedical services. That's if the individual needs injections, breathing treatments, catheter changes, skin care, suctioning, insertion of suppositories, so more medical, or they call it paramedical. And in order to get minutes and hours authorized for this, again, it's government, there's a form to fill out. The doctor has to state that the individual is in need of these things, and that the parent, or whoever the caregiver is going to be, whoever the IHSS provider is going to be, has been trained to provide that service. So it's another form that has to be filled out. Now, this is the sort of the jackpot. There's a category of IHSS called protective supervision. This is for individuals due to their mental impairment or mental illness need to be observed 24 hours per day to protect them from injuries, hazards, and accidents. And what they look at is the person's memory, orientation, and judgment. And they again, a form to be filled out by a doctor that states that due to the individual's memory, orientation, and judgment, they are in danger of harming themselves or putting themselves in harm's way. And on the form, it literally lists those three categories and asks for anecdotal explanation of how this person would put themselves in danger. What I recommend the families, excuse me, is to fill out the anecdotal part because the doctor is not going to take the time to do that, and then give it to the doctor to hopefully sign off and check that yes, this person does need protective supervision. Because again, that takes you to the maximum of 283 per month. There was a law or there was a regulation a couple of years ago that has been changed that in a two-parent household, that it only allowed the IHSS could only be provided if by the parent if one parent was working and the other parent was precluded from working to care for the child. That has now changed, that they don't look at that anymore. So either parent can be the IHSS provider, and it doesn't matter if one's working or not. Okay, moving on to Social Security. These truly are programs that are administered by Social Security Administration and funded by the monthly or whatever the paycheck deductions that an individual has from their paychecks over their lifetime. As I think everyone knows, there's a program called just Social Security Disability Insurance, SSDI. That's where you've worked, you've paid into the Social Security system, you become too disabled to be able to continue to work. You usually have to have paid in 40 quarters or 10 years to get that. This benefit is for the disabled adult to pull off of the parent's Social Security account, but there's some requirements in order to do that. This this program, this benefit pays benefits to adults whose disability began before the age of 22. They have to be 18. They have to be an adult. So they're over the age of 18. Disability has to be documented prior to the age of 22. And this program, it's called Childhood Disability Benefits. It used to be called Disabled Adult Child, DAC. Don't get confused. It's the same benefit. We just call it CDB now, Childhood Disability Benefits. The amount that the benefit does not affect the parent's Social Security payment, but it's based upon what the parent is receiving in Social Security retirement or Social Security disability. And the payment to the adult disabled child would be equal to 50% of what the parent's entitled to at full retirement age. And when that parent passes away, it goes up to 75% of what the parent was entitled to at full retirement age. So again, it does not affect how much the parent is going to receive, but the amount that the child receives is based upon what the parent is receiving. Now, if the parent paid into the Social Security system and wasn't making a whole lot of money, their benefit is not substantial. And therefore 50% of that benefit is not substantial. So the individual may qualify for both SSDI, CDB, and SSI. So they may get two checks. But if they're on SSI and they start to get the SSDI, CDB, that benefit is counted as unearned income. And as we said before, after the first $20, it reduces the SSI check. So you can see that if the SSDI, CDB check is of any substantial amount, it's going to reduce that SSI to zero.
Jim, can I ask a question?
Sure.
So let's say the parent has to be collecting Social Security in order for your child to qualify for this, right?
Either Social Security retirement or Social Security disability.
Yeah. What happens if just the parent dies? So the
If
child hasn't, the parent isn't on Social Security. They die before they're able to collect any Social Security. What would the child be eligible, and the child is, um,
yes,
would they be eligible to start collecting the childhood disability
if the parent,
benefit
yes,
upon the death of the parent?
yes, if the parent who died had paid into the Social Security system, even though they weren't pulling the Social Security retirement, but were entitled to it, then yes, the child could apply for that off the parent's Social Security account,
Okay, thank you.
which is good. Okay. So again, the parent must have paid into the Social Security system. Parent must be receiving either Social Security retirement or disability. Now, if a person has two parents, one parent may have a higher benefit than the other. So let's just say that the husband didn't make as much as the wife. The husband goes on Social Security retirement. The child gets CDB, 50% of what the husband is making. And then the mother goes on Social Security retirement, and her benefit is a higher amount. They do shift the benefit from the lower wage earner to the higher wage earner, which is nice.
There was a question, is when in the case that I talk about the parent having been deceased, is that called a survivor benefit?
I'm not sure whether it would be categorized. I'd have to check on that.
Okay, thanks.
Yeah. Um, Now, what always comes up, of course, is what is the effect on SSI and SSDI CDB benefits if the person goes to work? Well, first of all earnings must be reported to Social Security. If the person is their own payee for their benefits, they must report it to Social Security. If they have a representative payee, then that rep payee has to report earnings to Social Security. As I said before, if a person's on SSI, the SSI check will be reduced 50 cents on the dollar after the first $85 of earnings. It can, though, trigger a disability review. So, in addition to lowering the SSI check, it can also trigger a disability review, which is like applying for SSI all over again. In other words, they could say, Johnny, you're making $1,000 a month. We've reduced your SSI check approximately by $500, but we think you're capable of $1,690, and that you're just artificially holding down your wages, only taking so many hours of work per week because you want to remain on SSI. And a disability review is just like applying for SSI all over again. They're going to ask for updated reports from your doctors. They're going to review your work history. They're going to review everything. They may even want to have one of their doctors meet with the applicant to see if they still qualify as being disabled, because here they're showing that they can work and earn $1,000 a month. So I usually recommend to my clients that if they want their cake and eat it too, stay off the radar scope of Social Security, hold your earnings down to about 400 a month, because then you're well below the substantial gainful activity number of 1690. Now, if you're on SSDI CDB, it's handled totally different. You continue to get your benefit for up to 9 months in a 5-year window. So you're working, you've triggered a trial work period, and this in 2026, if you earn 1210, you trigger a trial work period, and you get 9 trial work period months in a 5-year window. And I know, Judy, you went through this with your son.
No,
Um,
I actually haven't hit this point yet.
okay.
I've just been worried about it, but he never earned enough to trigger this.
Okay. And then after that, there's what's called an extended period of eligibility for another 36 months. And you continue to receive benefits until you achieve, guess what, substantial gainful activity, which is at 1690. And if you achieve 1690, I put 1620 here. I should have corrected that. That was last year. Your benefits will cease. You will continue to get the Medicare that comes with this benefit. Medicare comes with this benefit after the individual is on it for 24 months. So if you go through the trial work period, you go through the extended period of eligibility, you lose the cash benefit, you still can remain on that Medicare for up to 84 months. There it is there. And as we know, Medicare is a much better benefit than Medi-Cal. So I have some families, when I talk to them, both parents say, oh no, we're not going to go on Social Security retirement till we're 70 because we'll get a bigger check. But then they start thinking about health insurance for their son or their daughter, and they realize that maybe the insurance for that adult child is coming through the parent's employer. And maybe the parent is going to leave that employment. And if they leave that employment, Johnny's not going to be able to have insurance off of that employer anymore. So one of the parents will say, oh, we better get Johnny on SSDI CDB, get that 24-month clock started so that when the husband leaves that employment, which is where the son is getting his health insurance, Medicare will be there to provide health insurance for Johnny. There is and this is an issue that we have with Medi-Cal, with county Medi-Cal. The scenario that I mentioned before is that when an individual shifts from SSI over to SSDI CDB of their parents, that's going to most likely eliminate SSI. Therefore, it's going to eliminate the SSI linked Medi-Cal. And Medi-Cal is really important many times because of IHSS. It's true they'll get Medicare after 24 months, but for that 2-year period, they're not going to have the Medicare. They will have lost the SSI linked Medi-Cal. So, and they need the Medi-Cal for that 24-month period, and they need it for IHSS. So to remain on Medi-Cal, there is a specific code, Medi-Cal code, that's for individuals exactly in this situation. They have to be over the age of 18. They have to have had SSI before the age of 22. They must have been found eligible for the SSDI CDB, and that they lost the SSI due to the receipt of SSDI. And the way that they're eligible for Medi-Cal is that the amount of money that they're getting off of the parents' SSDI through SSDI CDB is not counted as income. Therefore, their income is low enough to, guess what, qualify for Medi-Cal through the county. It's called DAC Medi-Cal. It's if you look at all the codes, the ways people can qualify for Medi-Cal, it's listed DAC Medi-Cal. And yet I have so many families that go into local Medi-Cal agencies, and the eligibility workers look cross-eyed at them as if they've never been trained on this. But there is such a thing as DAC Medi-Cal that will allow the individual to remain on Medi-Cal even though they lost their SSI linked Medi-Cal because they went on SSDI CDB.
So Jim, there's a bunch of questions, maybe 3 or 4, that about this whole area. So it's probably worthwhile to deal with them right now,
Sure.
if that's okay. All right. So someone asked the question, I could answer it, but if the amount for SSI and SSD are equal, are there benefits for moving from SSI to SSDI?
Oh, very good. You mean the amount of the benefit? I think I heard you say.
Yeah. So are there other benefits to SSDI? I'll go first.
Go ahead.
Medicare insurance versus Medi-Cal, number one. You have to wait 2 years, but Medicare is a much better program. There's just a lot more benefits with the medical insurance. Second of all, how it treats employment is different. It doesn't, you don't automatically lose money, a dollar for every $2 earned. So if you're within a certain range of salary, you get to keep your paycheck.
Right.
So that's a second benefit. And then how it treats employment, just in general, seems better. And then also, because it's not means tested, there's not as much pressure to keep your money down. But like if you're trying to get Medicare and Medi-Cal, you still need to stay within the SSI limits.
That's
Did I
right.
get
For
those
SS
right? And are there some other ones that I'm not mentioning, Jim?
Well, one of the big ones, of course, is that the amount of the benefit can be much, much higher. The amount of SSI is maxed at $1,233.94. The amount that an adult child could pull off of their parents' account through SSDI CDB, again, is 50% of what the parents get. So you have some parents that are pulling down, $4,000 of Social Security retirement. So that means that the adult child is going to get $2,000 at least, and then that's going to go up to $3,000 when that parent passes away. So the amount of money that is received under the SSDI CDB program can be much higher than SSI.
Okay, so I think I'm understanding this person's questions. That they were asking about money earned, and I think they're trying to figure out, does it matter if you earn the money monthly or annually? So in determining
Social Security will take if the person's earning money for some reason on an annual basis, they will just divide by 12.
but in general, like with SSDI, it matters whether you earn it in a month because it's triggered on a monthly basis. And so if you
Right.
get that number within that month, even though sometimes these things are very screwed up because you may be getting a bonus, you may be getting it may be a 5 week month, and so you get 5 paychecks. There are lots of reasons why you could have an inflated amount a month, and it matters.
It does matter for the SSDI CDB, of course, in the trial work period, it does not reduce your benefit. You continue to get the full check. But for SSI, yes, the amount of money they look at, when did you get paid that money? And if you get paid all in one month, they may well look at, well, what period of time was it earned, even though you got paid in one month.
Okay. So, someone wants to know if you can work if you're collecting SSDI.
Well, we've talked about that. You can.
Okay. And when can the disabled adult child start drawing the SSDI?
They have to be they have to be over the age of 18. Over the age of 18.
And the parents have to be collecting Social Security or dead.
Right. And
Uh,
usually an 18-year-old won't have parents that are on Social Security retirement yet, unless they are on Social Security disability. What
yeah.
what becomes problematic is that, let's say the parents don't go on Social Security until the adult child is like 35 years old. Remember, part of the criteria to be eligible for this benefit is that they have to be, quote, disabled prior to the age of 22. That means there has to be documentation that they were not capable of substantial gainful activity prior to the age of 22. So if you're dealing with someone who's 35 years old, that's what, 13 years prior. You got to get records from somewhere that show that the person was disabled prior to the age of 22. Usually those are educational records, but the schools don't always keep those records forever. They may destroy them. So parents should keep all their IEPs, they should keep all the psych reports and all the medical reports that were ever done, because someday if they want their adult child to go on that SSDI CDB, they have to show that the person was disabled prior to the age of 22 and have not worked substantially since they were 22. Because if they have, then they were not disabled after the age of 22.
And you got to keep all your payroll records
You
forever.
you keep it,
Back to age 18.
yeah, yeah. Well, they'll have your earnings record, but sometimes they're not correct.
Yeah, no, they even if they have them, Jim, they ask you for them. So,
Yeah.
um, there's one special case, and then we'll be able to move on. And it was from Kim. It's the child is currently receiving SSDI. I'm not quite sure how. You may want to explain. But they just applied for CDB today on the dad's record, but he's not collecting Social Security yet.
Well, they
She
can't
still
apply. They
get to
wouldn't have taken
keep
it.
her SSDI she's getting right now, which she probably shouldn't have applied if she she's not going to be
She,
eligible.
yeah, they won't accept an application if the parent's not, it's a requirement that the person be on Social Security, disability, or retirement. I do unbelievably have clients that are getting both an SSDI check off their own record and off the parent's record because the
They
person,
accepted they accepted the application today, so I'm assuming that means he is collecting.
Oh, okay. So you didn't know for sure whether he was collecting,
Didn't
huh?
know for sure, but they accepted everything, and I'm just getting her job coach to sign off on that she's got a job coach. So my question was more that if they deny her the CDB, CBD, whatever it's called, does she still get to keep her SSDI that she's been getting for the last 8 years?
well, you'd have to look at why are they denying the SSDI CDB.
Because they don't think that she is the job coach is the key because she would make almost too much for the threshold, and the job coach means that they would zero out her earned income. It wouldn't be counted as earned income if she has a job coach.
Well, they reduce the amount of countable income through what's called subsidized employment by the employer for
Correct.
a work activity form. So they may reduce it by 30%, 40%, or whatever. So then I would assume that mechanism would be used in order to show that they fit the criteria for not being disabled. And so that same criteria, again, it's the same criteria for SSDI and SSI. The
Kim, Kim,
SG is the same.
Kim, the one thing I can say is you can't say because you're dealing with human beings that aren't trained. The policy, it's very subjective the way they look at these things. And so you just they don't understand the rule. Social Security is run by people that are used to dealing with 65-year-olds. And we're like this special case and they're not trained on us. And
Sure.
so there's risk of them doing it wrong and you having to train them and so whenever you start communicating with Social Security, you just need to be careful and have some support in place to walk you through it
No,
because you just don't know.
I understand that. My question was if they deny her the CDB, which means she's not going to get the 50% of her dad's Social Security that he's collecting, does she still, though, go back to getting her regular SSDI that she's been collecting all this time?
Right. Well, if the denial for the SSDI CDB was because they could not find that she was disabled prior to the age of 22, but then after 22, she worked and got enough credits to pull SSDI off of her own record, she would be able to continue. That was why the first question
Okay.
I asked was, what is going to be the reason for the SSDI CDB denial? You got to see,
Be-
why was it? Did they say she wasn't disabled prior to 22? Or did they say she's worked since 22? They may say that because she's on SSDI, she's earned enough credits on SSDI on her own record to get SSDI, so she may not meet the criteria for CDB.
Correct. What you just said. They switched her from SSI like years ago to her own record. She's been collecting SSDI, and I just put in to see if she could collect the CDB against her dad's record, and she's right at the threshold of making the amount of money where they say no, they would deny her straight out. And the job coach is the thing that would bring her earnings down so she'd
Okay.
be below the threshold and she would get approved.
Okay. Well,
So am I understanding that correctly what happened today, or should I just shut
You're
up and I'll call
understanding
you
the
another
rule.
time?
Kim, I feel like you're understanding the rules, why you would be arguing for that, but that doesn't mean that that's what's going to happen.
that's
Oh
And
right.
no, I get that.
it doesn't, Kim, I'm just going to give a little advertisement. I did a survey of 600 people in the state of California. 75% of the people who worked had issues with Social Security. Of those, so the people who work, 3/4 of them had issues with Social Security. I read story, and Jim read these too, story after story after story of them losing paperwork, of bad decisions, of all sorts of things. So I'm just saying your argument is a good one, but the people you deal with and the system is broken. So it's just whenever you poke the bear, there's just a risk that you're going to be in an argumentative state with them to try, and you just don't know what they're going to do. And I
no,
wish that were true. It's just that's
and I'm not trying to argue. I'm just trying to make sure that I understand. And if we get denied and things go foobar, then I'm calling Jim and I'm going to employ him to advocate for my family. But I just wanted to make sure I was understanding what can of worms I have opened, and that what they were telling me, that I understood it, because it can be very wormy.
Yeah.
So thank you. I'm going to mute myself now so you guys can go on.
Okay.
Sorry, Kim.
No, that's okay.
Okay.
Okay. Other questions or move
There's
on?
one person who has her hand up. I can't see her name. We'll take that and then we'll continue. I'm sorry, I can't see your name, but you're.
Hi, my name is Jackie Castaneda, and
Hold
sorry,
on.
can you hear
Jackie
me?
is asking a question. Go ahead, Jackie.
Yes, I'm going to apply for SSI for the first time for my adult son. He is going to be 34 in June, and I'm trying to understand all the the different scenarios that you just explained. I don't know if I can apply from the first application directly to is it CDB? Because my husband was a state worker and he became disabled, had to retire early. So he does have take Social Security for disabilities, and he has his retirement at this point now too because of his age. So would it be best to apply for that, or do I need to apply for SSI first?
When you pass through the doors of Social Security, because SSI is a welfare program and SSDI.
Oh, I'm sorry. Should it be SSDI then I'm applying for my son then?
Well, no, I think you were asking what benefit you should apply for, and I was going to explain how it works.
Okay.
SSI is a welfare program. SSDI, CDB are insurance programs. And so they are the rules are that you first must, Social Security must first determine if you're eligible for anything out of the insurance pot. So if you were to contact Social Security and say, my son wants to apply for SSI and SSDI or SSDI CDB off the father's Social Security account, they're first going to look to see if he's eligible under the insurance pot, SSDI.
Okay.
If the amount that he would receive through SSDI CDB is of not a great amount, then they will also take an application for SSI. But it would not be the reverse. They won't do SSI first. But remember, SSDI CDB has other eligibility requirements. The biggest one, as I said before, we run into a 35-year-old. You've got to show documentation that he was, quote, disabled prior to the age of 22 and has not worked substantially since he was 22. And finding those records prior to the age of 22 it becomes difficult. Okay,
so then just to clarify, so your recommendation would be to first just start with SSI, an application for SSI for him. Is that correct?
The opposite.
No. I'm sorry.
When you contact Social Security, they will first see if he's eligible off of the father's account.
Okay, so I do apply off of the father's account first then.
Yeah. And by the way, you're not applying, your son is applying.
Correct. I'm sorry. Yeah.
That's okay.
He'll be applying.
Right.
And then, so is that the is it, what would I say that he's applying for then?
SSDI CDB.
SSDI CBD?
You see it on the screen?
It's right. It's the second line on the screen.
Okay. Thank you so much.
Yep.
Okay. So Jim,
I have a quick question.
Okay.
What is the limit of earnings if one is getting SSDI?
I'm sorry, I didn't get the first part.
My son is on SSDI, for example. he is getting SSDI. What is the limit of earning?
Oh, the
How
limit of
much
earning.
he can earn?
Well, I went through the scenario of someone that's on SSDI and the stages that they would go through. If he gets more than $1,210 a month, it will trigger a trial work period for 9 months in a 5-year window, and they will look at whether or not he's disabled anymore. But after that, if he achieves SGA, which is $1,690 a month, his benefits will stop. So there really is no limit, so to speak, but there are certain amounts that trigger events. 1,210 would trigger a trial work period, 9 months in a 5-year window. And if he goes to 1,690, he's going to lose the benefits. So
Okay.
I always tell my clients, stay down to about 400 if you want to be really safe.
All right. Thank you so much.
Thank you. Okay, go ahead, Jim.
Okay, moving along. Regional centers are not state agencies. They're private nonprofit corporations. A lot of people think they're state agencies. They're not. I mean, they're run almost like state agencies, but they're 21 independent boards, nonprofit organizations, and the boards are made up of individuals with disabilities as well as the parents of the individuals with disabilities. The regional centers have contracts with the mothership, I call it. That's the Department of Developmental Services. Good luck to you too. This is crazy making, someone said. Yes, this whole system is. You are correct. Regional centers provide and coordinate services and supports for individuals with developmental disabilities. This is a map that shows all 21 regional centers throughout California. And you can see Orange County down there is one of them. Eligibility for regional centers is not income or asset tested. So they don't look at how much except for a couple of different services, which I will talk about in a moment. The criteria for being eligible for regional centers is based totally on meeting the definition of what a developmental disability is. There's no income or asset test. And regional centers are unique to California. There are 2 programs that regional centers administer. One is the 0 to 3 program, in other words, children 0 to 3, and then there's the over 3. Lots of families think that regional centers only do 0 to 3 because at age 3, the regional centers many times say, we're going to turn you over to the schools, and the schools are going to provide you services for the next 12 years. Well, at age 3, the regional center is supposed to determine if the person meets the criteria for being developmentally disabled, which if found eligible for that, they will have regional center services for the rest of their life. So there's quite a difference between being found eligible for over 3 and not. For the 0 to 3 program, and you can cursor up if you would, Judy. The Early Start program provides children younger than 3 years of age who have exceptional needs, who are at risk of becoming developmentally disabled or may have developmental delay. They can qualify for services. Next slide. So the Early Intervention program provides occupational therapy, physical therapy, speech and language. Next slide. Now, for meeting the criteria for over the age of 3, the person must have a developmental disability that begins and is documented prior to the age of 18, expected to continue indefinitely. And this is the most important part. It constitutes a substantial disability for that person. Next slide. So the qualifying conditions are intellectual disability, cerebral palsy, epilepsy, autism, or the famous 5th category called disabling condition closely related to an intellectual disability or requiring treatment similar to that required for individuals with intellectual disability. Next slide. This is important. Disabilities that are not a developmental disability, learning disabilities. If a person solely has a learning disability or a mental health disorder or a physical disability, except for cerebral palsy, they're not eligible for regional center unless they have a secondary disability of one of those. You could have a person with autism with mental health, or you could have a person with autism with a learning disability. But if their disability is solely learning disability or mental health or physical, except for cerebral palsy, they're not eligible for a regional center. Next. But the second part of the definition that many times parents don't understand is that the developmental disability, let's say autism, has to result in significant functional limitations in 3 or more of the following areas: self-care, receptive and expressive language learning, mobility, self-direction, capacity for independent living, economic self-sufficiency. So there can be times when you could have an autism, high functioning autism, who can take care of themselves, can live independently, can have a job and be economically self-sufficient. They may not qualify for regional center because they have to meet 3 of those 7 areas. Next slide. Regional centers' responsibilities. Regional centers do not provide direct services. Instead, they identify, approve, and fund community services and pay for those through hundreds and hundreds of vendors. Now, the part that always gets parents is that regional centers must pursue all other possible funding sources before they get their checkbook out. So if you ask for a service from the regional center, let's say behavioral services, they're going to say, well, you got to go to your private insurance first. Or you ask for some types of therapies, they'll say, well, your child is of education age, you've got to go and get that through special education. Or if it's a medical need, they'll say, well, you've got to go not only to your private insurance, but if the individual's on Medi-Cal, you need to go to Medi-Cal and get a denial. Or if you're asking for support services, they're going to say, well, you first have to go to IHSS and see what you can get there. So regional centers are considered payer of last resort. Next. So regional center services are all determined through the IPP. That is the contract. That is the entitlement. If it's not in the IPP and agreed to be funded by the regional center, it's not going to be funded. So the philosophy is to provide services that will allow a consumer's life to approximate that of his or her same age non-disabled peers. And services many times do vary from one center to the other. You could have services out in the middle of Kern County look a lot different than services in Orange County. Next slide. The services are all done through IPPs. Many of you know IEPs, Individual Educational Program through Special Ed. IPP, Individual Program Plan, is what the regional center uses. And the planning team for that is made up it could be just 2 people, the consumer if it's an adult, parent if it's a child or a conservator of an adult, and a representative from the regional center. But there also can be other people that attend the IPP meeting, family members, friends, neighbors, service providers, any individual invited by the consumer or the authorized rep. Next slide. The required components of the IPP: assessment, goals, objectives, services, and supports to achieve the goals, whether those goals are funded by the regional center or not. Next slide. Now, there's really a neat thing that regional centers can do. There are times when the minor child is in need of IHSS, but they can't get IHSS because they don't qualify for Medi-Cal because the parent's income and resources are too high. But through a process called institutional deeming on the Medi-Cal, the minor regional center consumer aged 3 to 18 can get Medi-Cal if the regional center is paying for at least one service. The regional center asks the local county Medi-Cal agency to place, well, the regional center places the child on what's called the DDS Medicaid waiver, and then requests the local Medi-Cal agency to institutionally deem the child on the Medi-Cal by only looking at the child's income and resources, not the parents. So that's a way that we get children onto Medi-Cal whose parents and income and resources are too high to qualify the child for Medi-Cal. Through institutional deeming, we can get the child on Medi-Cal. Once on Medi-Cal, we can apply for IHSS. Next slide.
Oh, that's great.
Regional center services, broad array of services, board and care homes, their services through intermediate care facilities. Actually, those are funded by Medi-Cal, independent living skills training, supported living services. Those can be either done in the consumer's home now, or it can be done in a home that the individual resides in. The regional center cannot pay for that home that the consumer lives in. The parents are going to have to pay for that condo or that apartment, but the regional center can pay for the staff necessary to support the consumer to live safely and successfully in that apartment or whatever. Next slide. Other regional center services: in-home respite, out-of-home respite, transportation, adult day programs, supported employment, that was mentioned by one of you folks, the job coaches, can be paid for through supported employment agency. Behavioral services, but you are required to go through your private health insurance. Next slide. And of course, like in any system, there is a appeal process. The first level of appeal is if the regional center says no to anything, you can appeal it and have what's called an informal meeting. You would meet with someone from the regional center that was not involved with the original denial. It is recommended that you do take that as a first step. On some of the issues, you can go to mediation, where an issue could be resolved, and it is a confidential settlement. So sometimes you can get the regional center to agree to something because it's not going to become public information. The next level of appeal is in front of an administrative law judge. Next slide. I think that probably that concluded the regional center section. So are there questions about that?
All right, let's see. Okay, and that's kind of the conclusion of your presentation today. So we're right, Jim?
Correct.
Jim, before we take questions, why don't you just quickly explain how you work with people?
Sure. Yeah, I work with families all over the state. I'm a public benefits consultant advocate, which means that I assist families in navigating through all of these systems, either through Social Security or through the regional center, special education, IHSS. I attend IPP meetings. I attend IEP meetings. Everything's done by Zoom these days. So I can assist families as much or as little as they need. I can do a lot of hand holding, or I can be in the background just assisting them as issues come up. So that's how I work with families.
Okay, thanks, Jim. All right, are there any questions? It's 8:16. Any questions out there? You can raise your hand and I'll call on you. Okay, here's one. Can regional center Medicaid waiver end at some point when the child becomes an adult?
No, the Medicaid waiver program being used for institutional deeming, there really isn't a need for an adult regional center consumer to be on the waiver. For a minor, it's important because we can do that institutional deeming process of getting them approved for Medi-Cal. But once they become over 18, it really is transparent. You'll get the services from the regional center, whether they're on the waiver or they're not on the waiver. It doesn't matter.
So you get Medicaid by being a regional center client?
Through the institutional deeming process that I mentioned.
But if you're an adult?
If you're an adult, no, you don't get Medi-Cal. No, being on the waiver doesn't give you Medi-Cal. Well, let's back up. There's many different types of waivers. There's the DDS waiver, and that's the one that we've been talking about. It's for minor children in order to institutionally deem them onto Medi-Cal. There's home and community-based waivers. That's where an individual can receive nursing level of care in their home. That is not a regional center waiver. That is a Medicaid waiver to receive medical services in your home rather than in a nursing facility. So that's a different kind. There's funding through supported living services. There's a number of different Medicaid waiver programs. But if you're with the regional center system, Medicaid just pays about 30% of all the bills. It funds about 30% of the regional center budget, but it's transparent to a person who's over 18 whether they're on a waiver or not. But applying for Medi-Cal is a separate process. If they're on SSI, they get Medi-Cal. But if they're not on SSI, then they would have to apply to the local county Medi-Cal agency to get onto Medi-Cal.
Okay, here we go. Some more questions. Kim wants to know how you are paid for your services.
I get referrals from parents. I get referrals from, I deal with a lot of families that have special needs trusts, so I'm paid by the special needs trust. So it's either families or from the trust. I do require a retainer, and I bill hourly against that retainer. If we get done with our business before the retainer is used up, I reimburse the balance remaining on the retainer back to the family.
Is there any reason not to have my child use the parent's health benefit prior to Medi-Cal, I guess? Is there any reason not to have my child use the parents? Chanel, I don't understand
I
the
don't
question.
understand the question.
You want to take yourself, Chanel, you want to ask, you're off mute. So you want to ask the question again?
Is that the one that's at the bottom of the screen right now?
No. Okay, we'll move on. What are the negatives of an 18-year-old getting Medicaid?
Medi-Cal?
Yeah.
Understand, folks, let's get our terms straight. Medicaid is what is Medi-Cal in California. There's no Medicaid in California. It's called Medi-Cal. But in every other state, it's called Medicaid. Medicare is then the other benefit. So in California, you have Medi-Cal and you have Medicare. So what was the question again?
So what are the negatives for an 18-year-old getting on Medicaid?
In other words, on Medi-Cal. Well, there's no negatives.
Yeah. Can a disabled child be on Medicare and Medi-Cal at the same time?
A disabled adult child? Are we talking about?
Let's just answer it for an adult child.
Okay, an adult yes, an adult disabled child can be on can be what we call Medi. They can be on Medi-Cal and Medicare. Yes.
Okay. And I'll just explain that a little bit more. So the way that happens is when they're on SSDI, they get on Medicare. There's that 2-year waiting period where you're not on SSI anymore. You're on SSDI or you're, doing the CDB, but that doesn't entitle you to insurance. So what happens is they send you over to social services, and then you can apply for Medi-Cal just because as a service just on its own. And then you get that, and then now you're on Medi-Cal, and then when you get on Medicare, now you have Medi, and that's how it works. And as long as you meet the requirements for Medi-Cal, you stay on Medi-Cal. They need to know how much you're making, how much money's in your savings accounts. They go through an annual review to make sure you're still qualified.
Correct.
Okay. While the DAC waits for the decision on SSI eligibility, they apply for Medi-Cal where? Social services.
Through your local Medi-Cal agency. Every county calls it something else. Sometimes it's social service agency. Sometimes it's health and human services. But it's the agency in your county that handles Medi-Cal.
Okay. Oh, Chanel's. Okay.
Excuse me.
Yeah.
Can I follow up on the the answer right now.
Sure.
So if they apply to local social agency, that means that medical will be based on the income level, right?
Yes.
So in that case, during that time, parents cannot claim that disabled adult child as dependent.
That's a tax question. I don't do taxes.
In
Is that
order
what you,
for
that's what you
parents
meant?
in, I think it's related, yes, but the social agency will be asking for income level, and in order for the parent's income level not to be counted, so the adult child will get medical. They cannot claim they have to distance themselves. Parents have to distance themselves from the child, right? So it's
Now,
no.
I'm not sure I'm following. Are you talking about an adult child, a minor
Yeah, I
child?
think she's thinking the adult child has to be not a
Dependent
it
of
is
parents.
independent. They need to be independent. They not shouldn't be treated as a dependent on their parents' tax return, is what she's asking.
Well, I guess I would like to confirm that medical will be based on income level, and in that case we have to gather like all possible documents to make sure that the child have low income level and is not dependent on parents. Like parents do not provide any material
Yeah,
support.
I've gone through it I've gone through it every year. You need to give them all your bank accounts. So they need to see how much money is in all their bank accounts. They even want to see the special needs trust,
Yeah.
even though they're not supposed to care about that. They need to see how much money they're earning. They need to see, all their income things. So it's a complete disclosure of your child's financial situation in order to qualify for Medi-Cal.
Okay, thank you.
Okay,
Thank you
sure.
so much.
You're welcome. It's not fun, but it's what you do. Okay. Jim's hourly rate, you can put that in the chat, Jim. I you know how that works. Someone's asking about your child and what is an example of how much of a retainer.
I can tell you, my hourly rate's $375 and the retainer's $3,500.
Okay. Okay. If your CDB been okay, that's back to Kim. Okay, Hillary, will tonight's Zoom be accessible in its entirety on the OCSG website after tonight? I have to edit it. I have a life. It may take a few days, but will eventually be on the website. I sometimes think about the questions and how personal they're getting, and I may edit out the Q&A portion based on me trying to preserve your privacy. I haven't made a decision yet. It's a little bit arbitrary, but I just don't want people's life story on our website because it's publicly accessible. Can an ABLE account transfer to a sibling on death? So this is kind of best beneficiaries of ABLE accounts. Jim, do you know anything about that?
I don't know. I mean, an ABLE account is only available to an individual who's disabled prior to the age of 46. So the sibling would have to be disabled prior to the age of 46. I don't know what the ABLE rules are for transferring funds between ABLE accounts.
Yeah. You'll have to find that someplace else. Okay. If possible, can you speak briefly on Department of Rehab? Oh, we didn't go into that. If you are waiting for adult SSI approval and have never worked but are going to meet with DOR, does this possibility make it harder to get SSI approval? Hope that's clear.
No, it's just one of the, no, the determination of being eligible under any of these programs are you disabled? And that means, are you capable of grossing $1,690 a month? If you're working with the Department of Rehabilitation, that hasn't proved that you're capable of 1690 or not. If the Department of Rehabilitation gets you a job and you start making 1690 or even 1210, then yes, that would affect your SSI eligibility.
Okay. I'll say one more thing about that. Both DOR and Regional Center have a service called, is it WICA, where there'll be individuals that will help you look at your work plan and look at benefits and help you and help advise you on how you maintain your benefits when you're working. So you can ask your service coordinator or Department of Rehab if you have a case open for that kind of support. And so if you have these kind of questions, that's a free service that you can access. Take it all with a grain of salt. But I should mention that. Did you want to add anything to that, Jim?
No, I think that's good.
Okay. Joe asks, if you are autistic, does that generally mean you are disabled before 46 by default? So I think what's important in this, Jim, is how people prove that they're disabled. And every benefit that you talked about, it's a different process. So you want to talk to that a little bit? Like ABLE, it's just clicking a box.
It's pretty simple. Automatically, if Social Security has found you disabled, you meet the criteria for an ABLE account. If you're not on any of the Social Security programs that have determined that you're disabled, you do need to keep on file a letter or documents from your doctor saying that you're disabled. You don't have to show those to anyone. You just have to have them on file. I've never heard of CalAble asking for a copy of those.
Yeah, ABLE account, it doesn't require, but a lot of the other services, it does require actually seeing your diagnosis. Definitely, when you apply for SSI, they like to see your whole medical history and whether you ever had your tonsils out. I mean, it's that kind of detail. And what doctors do you see, and showing your report. And Regional Center, it's been a long time, so I don't know. They do ask for your IEPs from school, and they do ask, you want to describe what you need to do for Regional Center? Because I certainly can't do it.
Regional Center is, you have to have a developmental disability prior to the age of 18. So we sometimes have people coming to us like 50, and they've never received any services from any public agency. The parents have just always paid for everything. To get eligible for Regional Center, we have to go back in time and find documents that show that the individual was developmentally disabled prior to the age of 18. And that's sometimes extremely difficult. And not only does it have to show that they had the diagnosis, but if you recall, it has to show the 3 of 7 areas in order to meet that second eligibility criteria.
How is inability to SGA determined? Is it go through interviews but not getting hired? Or is it getting hired but fired shortly after?
All of the above. When you apply for benefits through Social Security, they're going to want to know all this, what's called sources from which they can obtain your records, medical records, psychological records, work records. They're going to ask you about every job you ever had. What did you do? Why did you leave that job? If they cannot determine whether you're capable of SGA based upon all of those records, then yes, they will schedule you to be seen. They will schedule the applicant to be seen by one of their doctors. And their doctors are pretty tough. If you walk in the door, if the applicant walks in the door, looks them in the eye, shakes their hand, I've had parents say that they have been found not disabled because of that. So what I always tell parents is we need to be sure we get documentation of the disability from every source possible. Have the doctors that you've seen over the years write letters that state not only that the person has such and such disability, but that that disability precludes the individual from working substantially.
Okay. What is the process for asking the Department of Rehabilitation for college tuition assistance? How do you qualify? How long does a decision take? What is the criteria?
Well, the process of DOR is that the counselor and the individual meet. There could be interest testing, aptitude testing, and a vocational goal is agreed to by both parties. And then it's decided, well, what's it going to take to get to that vocational goal? Is it going to take some community college? If it's going to take 2 years of community college, then yes, the department DOR can pay for tuition, books, and supplies. Although if the person's on SSI, usually they get what's called a Board of Governors grant, and a lot of those fees are waived. But if the college that is being requested is required to reach the vocational goal that has been agreed to, then DOR can pick up the tuition, books, and supplies as long as the person is making steady progress and getting good enough grades and taking the courses necessary to achieve that vocational goal. So it's got to be tied to the vocational goal.
So, and you should know that as of now, DOR is now waitlisting people. You're not going to get it, open up a case immediately. And prioritization is given to those who are most disabled. So if you just need a little bit of help, you may not get it. So that's kind of the state of where we are with Department of Rehab at this point. Is that your understanding, Jim?
Yeah, there's going to be funding cuts coming, I'm afraid.
Thank you, everybody. It's been a wonderful evening. Thanks so much, Jim, as usual.
Certainly.
So much great information. We really, really appreciate your support.
Certainly. Thank you for having me, and I'm happy to talk to any families that are interested in having me assist them.
Yes,
Robin,
thank you so much, Jim. You're amazing.
You're welcome, Robin. Nice to meet you, and congratulations.
Thank you.